Welcome back. With cold and flu season now in full swing, everyone wants to know how they can protect themselves from all those aches and pains. And here with details on a clinical research trial that's trying to help develop preventative vaccines for the dreaded flu bug is Dr. Robert Jeanfreau. Thank you so much for joining us.
Thank you.
Talk about what you guys are looking at, because everybody out there is probably saying, wait, I just got my flu shot. I just got a flu vaccine. What are they working on?
Well, I work for Benchmark Research, and my brother and I are research investigators. Mm-hmm. We do a lot of vaccine studies. Currently, we're doing a lot of flu vaccine studies. The current flu vaccine that's available is made by using embryonated chicken eggs. Mm-hmm. Takes 8 months from start to finish to achieve that. A very time-consuming and labor-intensive process.
Right.
A number of companies are looking at ways in doing it in a much more efficient way and quicker.
Okay.
And anytime you do something different, even if you end up with the same product, if the process of making it is different, you have to go through an FDA approval.
How could you speed that up? I mean, what are some of the ways?
What are some of the ways?
In English.
Yeah, there's a couple of ways they do it. Instead of growing the virus in a chicken egg, they grow a virus in mammalian cell lines. They put them in these big vats, and they can grow it very fast. There's a couple other ways, but I'm a little bit limited in discussing how those are attained.
What you guys are hoping for people to come out and volunteer to be a part of the study?
Well, we're always looking for reliable participants. You know, how great would it be if we had a vaccine for HIV disease? Mm-hmm. It's not going to happen unless you get people who are willing to volunteer to do it. And the volunteers are really unsung heroes in our community because they're willing to take risks for the benefit of everyone else in the community. We all take medicines, all of which have gone through a rigorous FDA process. And only a small number of people actually were willing to help get it through that process.
What kind of risks are we talking about when it comes to studies for flu vaccines?
Obviously, the risks are going to vary depending on what you're studying. In the case of flu vaccine, far and away the biggest risk is local inflammation from the injection. Basically, the same sort of risk you would get from a regular flu vaccine. Mm-hmm.
So it wouldn't necessarily affect your immunity? What if you, I guess if you got a placebo, then?
Yeah, now some of the studies do use placebos. Mm-hmm. Some of them use an active comparator like the regular flu vaccine. So if you had obviously, and these are double-blinded studies, so you're never sure if you've gotten the real vaccine, if it's a placebo-controlled study. So if you get the placebo, you would be at risk for influenza.
So you guys aren't necessarily looking at how to improve the flu vaccine or make it better, you're just looking at how to make it faster?
Basically, yes.
What are some of the other studies you guys are working on?
We're looking at another vaccine that involves pertussis, diphtheria, and tetanus. Mm-hmm. That's particularly in the over age 65 age group. We've done all kinds of vaccine studies. We've recently completed a study on cigarette cessation using a vaccine. Mm-hmm. But we do all kinds of studies, but mainly vaccine studies. We're also involved in hypertension studies, osteoarthritis studies. It really spans quite a spectrum.
And do people normally get paid if they help you and participate?
The volunteers get paid. Of course, it depends on how frequently they have to come in, but they get paid for their travel time, and it varies from study to study how much they would get paid. It could be anywhere from $50 to a couple $100.
How do people get involved?
We have a website. We have some phone numbers. Benchmark Research has a website, and they have a 1-800 number. I don't have that one memorized, but if you go to the website, it would be on there.
Benchmark Research.
Yep.
All right, Dr. Jeanfreau, thank you so much for being with us. And coming up right after the break,